Agriculture Organization of the United Nations in Rome. And well, I'm here as a focal point for this activity from my organization. Well, I work as AMR coordinator and supporting also the research. Over to Elizabeth.
My name is Elizabeth Erlacher-Windel. I'm working on the World Organization for Animal Health. Maybe some know it through the old name, which is OAI. I was there the head of the Veterinary Products and Antimicrobial Resistance Department, and now I'm working as senior advisor with mainly focus on research activities related to antimicrobial resistance. Over.
Thank you, Francesca and Elizabeth. And I'm team lead at the Impact Initiatives and Research Coordination Unit of the WHO AMR division. I would like also to mention our colleague from UNEP, Aitziber Echeverria, Program Management Officer, and UNEP Liaison Officer to the AMR Quadripartite Joint Secretariat. Unfortunately, she couldn't join this webinar. As I mentioned, this is the second webinar as part of the webinar series that the Quadripartite Technical Group is conducting to present and discuss each of the pillars included in this research agenda. Something that is important, as you will see during the first presentation, it's important to mention that this research agenda for AMR is focused on the interface of the One Health sectors. Before we begin, and for the optimal development of this webinar, let us all convene some housekeeping rules before we start. Francesca, can you share the screen? Thank you very much. Please keep your microphone on mute. Please rename yourself with your organization or country followed by your name. To do so, please right-click on your own box, click on rename, and type in the requested information. Be reminded that the views presented are those of the speakers. We kindly ask you to refrain from advertising your services, your company, or any product or brand. Post your questions in the Q&A box by clicking on the Q&A link at the bottom of this screen. Please do that after the panel discussion, because some of your question maybe can be answered during the panel discussion. And if it's possible, please indicate to whom of the panelists you would like to answer the question. We will answer your question during the Q&A session. Finally, we remind you that this meeting is being recorded. The video recording and the presentation will be posted on the Quadripartite AMR website. And now, without further ado, let's begin. Francesca Latronico will present the background and research areas identified in the transmission pillar of this One Health Priority Research Agenda for AMR. Francesca, the floor is yours.
Very much. So first of all, again, day everyone. And as it was highlighted by Jorge and also Elizabeth, this webinar is focused specifically on the transmission pillar. And this aim more specifically to unpack and discuss the results on the research areas regarding the transmission pillar. More specifically, within this presentation, aim it is to tap on the overall process and the development of the antimicrobial resistance One Health Priority Agenda, provide more information on now and what the specific details for the transmission pillar, and also to set the scene for panel discussion. And we have here like different colleagues that have participated in developing this agenda that will help us to unpack a bit what it is behind this specific pillar. First of all, the priority research agenda focuses on antimicrobial resistance and One interface. It is important to recall what we are defining as One Health. Some definition was provided from
Francesca.
One Health. Yes.
Sorry, the sound is not so clear. So
okay. I don't know how to. Let me find it away. Can you hear me better?
Yes.
But I cannot hear you. You hear me? Okay. Okay, so well, as I was saying, as a first, since this One Health priority research agenda focus on health interfaces for AMR, it's important to recall what we define as a One Health. So definition was set up by One Health One Health high-level panel in 2021, and considers One Health an integrated unifying approach which recognizes the interconnection among sectors. The approach mobilizes multiple sectors, disciplines, and communities at varying level of society to work together and contribute to sustainable development. Specifically, this addresses the health of people, animals, ecosystem, including also land sector. We have been hearing more and more, and there is also a need to have guidance to maximize the resources and also to have a more overall coordinated approach at global level among the different panels. The antimicrobial resistance One Health priority agenda was long overdue. And it was already first mentioned in the Global Action Plan, the document which was released 2015 for antimicrobial resistance. And then the importance was to have such a document was reiterated in 2019 by the Interagency Coordination Group on AMR, and most recently also in the Quadripartite Strategic Framework. In addition, it is also included within the activities for the One Health Joint Plan of Action. The overall aims of this document, this exercise, have been to catalyze the interest among researchers and learners of the AMR. And as it is, as we know at the moment, based on the information from the dashboard of the Global AMR Research and Development Hub, only 6% is currently allocated to One Health research. It was also to provide direction for investment in One Health AMR research with a focus on low and middle income countries. And it is actually also an advocacy exercise. And finally, also the aim was to identify and prioritize research areas at the interface that will inform policies and practices for providing evidence relevant to countries. To sum up, like what are the characteristics of specific documents? It was meant to be global, and it is a global exercise. Was focusing on the interfaces between the one sector. It included the antimicrobial resistance microorganisms, focusing on bacteria, parasites, and fungi, and the time frame was up to 2030 as for the Sustainable Development Goals framework. Were not included within the scope of the One Health priority research agenda, the research and development of new antibiotics and antimicrobials and vaccine, development of diagnostic, and the research related only to a specific sector. The objective were to improve our understanding on the transmission of antimicrobial resistance, including the drivers and the impact among the different sectors, to strengthen the evidence base for the intervention, and also to advocate for the prioritization of mitigation and to inform policymakers, providing information that could be easily translated at a different level of control antimicrobial resistance. The specific pillars or the topic that were identified in a preliminary scoping review were actually 5. So the transmission, the integrated surveillance, intervention, behavioral insight and change, economic and policy. In addition to this, there are also some cross-cutting areas as gender, vulnerable population, and sustainability. Overall, the process from the first step until the launch of the final report took around 3.5 years and included the academic scoping review, a global online survey, which was open for suggestion to whoever was interested, and which also provided the data which were analyzed and fed the Delphi panel together with the result of academic and literature review. Delphi panel included we include 89 experts, although like accreditation was more than 100 experts, and was conducted in 3 different rounds. At the conclusion of the process, the document was formally launched this June, and we are now engaging this implementation. The Delphi method which was used for as prioritization exercise was conducted considering different criteria. So the experts were requested to prioritize or also add the new research areas that they thought were important to also consider based on 5 different criteria, which were important. So if the research areas which was put forward was actually critical to address some specific gaps, if it was a topic that could improve and strengthen research capacity, especially in low and middle income settings, if it was generating understanding and actionable evidence, if it was also inclusive and impactful. More specifically for the transmission pillar, this was focusing on understanding, like try to really hard for where the transmission, the circulation, the spread of microbial resistance occurs among the environment, plant, animal, and humans, what drive the transmission, and also what is the impact. Also included the transmission dynamics, the risk assessment and modeling, and practices that could enable the development and spread of AMR at the one-air interfaces. Considering what were results, so the academic literature review and the Greek literature review were covering the period of beginning January 2015 up to end of 2021, March 2022, respectively. And at the end, there were 54 documents which were considered relevant, and doing analysis more in depth of this document, 455 research gaps were identified. For the transmission pillar, these were more specifically 131. This is actually the research areas that had like more identified gaps. Then for the global open call, this was open between July and September 2021, and received 1,620 anonymized responses. And these identified more than 2,000 research questions which were suggested. And for the transmission pillar, more specifically, these were 468. The Delphi process for the transmission pillar included 21 experts, which agreed to the prioritization for specific research area. This was conducted in 3 different rounds, and the number of experts that actually replied was different. From the first round, we had 25 research questions, and it ended up at the end with 15 research questions which were put forward for inclusion in the top 10. At the end, actually, the process for the transition pillar, 13 research areas were identified and prioritized by different experts. After a process of the Delphi panel, we also had an additional consultation meeting with the specific panel, and this helped to consolidate the result, but also to divide the research areas in different categories. For the transmission pillar, they were divided in methodology development, operational research, dynamics, and drivers. And this was done also to facilitate and provide further guidance for the sequence and the impact that the specific research areas could have. For the methodology development, they were identified two specific research areas, which are toward the identification and quantification of sources and drivers for development and distribution of AMR within the One Health sector, but also to identify or define what are the method and the data for describing and predicting antimicrobial resistance transmission at the interfaces. For the original research, these research areas were considered like important. Considered the impact of the different infection prevention and control practices for the AMR development and circulation. Then also the differences that there are in One Health AMR transmission, considering high income setting versus the low and middle income setting. Also, the impact of the different wastewater treatment solution on for the AMR development. Then also the contribution of water sanitation, the hygiene infrastructure, and then finally also the differences that could be for the AMR circulation, considering the critically important antimicrobials. And finally, for the dynamics and drive, which is actually very specific for this pillar, were considered like what are the impact that transmission of the focus on conditions relevant for low income countries. Also, it is the contribution of human and animal effluent and solid wastes in their management and treatment in different geographical settings. Then also will be important to identify what are the most important AMR transmission pathway at One Health interfaces, considering different sectors, including low and middle income countries. Then what is the contribution of aquaculture and the different aquatic farming technique and system. And what are the economic factors that could affect the use and the transmission in the different geographic settings? And finally, what are the contribution of effluent and solid waste for pharmaceutical and other industrial production sites to AMR circulation across One Health in a different geographic setting? For the next step, now we have actually, let's say, we are, as I was saying, engaging for like the dissemination of the expert and then scientific community, but there are also a step that will be considered more at the regional and national level. We try also to force with this research agenda the creation, also the development of interdisciplinary multi-sectoral research networks. And we are engaging also, of course, with our collaborating reference center and the different scientific community that we are happy actually to receive, like to be in contact with them and happy to be contacted. And then now, as the final step also, there will be the next webinar, which is foreseen on integrated surveillance for the end of January. Then Jorge, over to you.
Thank you very much, Francesca, for the presentation. Now we have a good understanding on how the research areas of the transmission pillar were developed and identified. So let's move to the panel discussion. For this panel discussion, we count on some of the experts who participated in the development of the One Health Priority Research Agenda for AMR. They will share experience on research on the transmission of AMR and also how this agenda contributes to getting more evidence on the transmission of AMR among sectors and help countries to better introduce interventions to contain AMR. To this end, I hand over to Elisabeth Erlacher-Bindel from WA. Elisabeth, the floor is yours.
Thank you. I hope we don't have an echo anymore. There were some problems. Is it better now? Okay.
Yes.
Yeah, we are sorry for this. So we don't really know where it comes from. So it's my pleasure. We have 5 panelists. You see them already on the screen, and I will introduce them one by one. And we've prepared questions that we think are highlighting the problematic or the questions about transmission, and also with a link to our research agenda. So we'll start with Professor Heike Schmidt. She works on the transmission of antimicrobial resistance with focus on environment. At the Dutch National Institute for Public Health and Environment, she's team leader on AMR in the environment and also leads the environmental part of the Dutch National Action Plan. She works also on international level on capacity building for international One Health surveillance and antibiotic resistance within the WHO Collaborating Center on Risk Assessment of Pathogens in Food and Water. Heike, if you can unmute, I will ask you the first question we have to you that I think is of interest to everybody. What do you think is the current knowledge on the role of the environment in the on AMR transmission? And how could the AMR One Health research agenda contribute to get better understanding? Over to you, Heike.
Thank you, Elizabeth, and thanks a lot to all of you to organizing such an important webinar stressing the research needs on transmission. And I think to start with, it's indeed one of the most important outcomes of the One Health priority research agenda is that there is a need for more research establishing transmission, One Health transmission, and specifically so from the environment to humans. Because actually for transmission of resistance from animals to humans, there's quite a large body of evidence that has been well established, but much less so for the environmental domain. There, evidence is just starting to build up in a way. And well, do we know? First indications mainly come from Europe, where transmission is studied, for example, through recreation and surface water. And indeed, it has been found that recreation can lead to an increased carriage of particular resistant bacteria in exposed human populations, in swimmers and surfers, although this was not the case in all the studies that were undertaken. But then if we move to low and middle income countries, evidence is much more sparse. And mainly that is based on the lack of studies that particularly and specifically address transmission between the environmental compartments and humans. In general, in analogy with other pathogens that are transmitted fecally, orally, environmental exposures are highly likely to represent a transmission route also for antibiotic-resistant bacteria. And the existing evidence has indeed shown that the levels of contamination of, for example, surface waters with antibiotic-resistant bacteria can be high, where we do have studies, and that resistant bacteria or resistance genes can also be found in drinking water. But what is often lacking is, in these existing studies, is the link between the actual presence of the bacteria and the human health, so the evidence for the actual transmission. So what is now in low and middle income countries? So what we know is that with respect to human carriage of antibiotic resistant bacteria, higher rates of carriage have repeatedly found in the wet season, which is important in many countries. And this is most probably mediated through exposure to environmental reservoirs. Also, this has been found for countries such as Madagascar and Malawi, and specifically so for specific bacteria ESBL producing E. coli. And also in meta-analysis in African countries, it has been shown that drinking water quality can influence the carriage of ESBL producing E. coli. So we're starting to see evidence, but still, as said, the overall number of research studies addressing environmental exposures is very limited. And therefore, the One Health priority research agenda represents an excellent opportunity to direct research to relevant topics. And what I think we are specifically in need of are studies that explicitly address environmental exposures, if anyhow possible, in epidemiological investigations that link environment and human health. These could therefore couple measurements of resistant bacteria in environmental compartments of interest with analysis of the prevalence of the human population, and then both for exposed populations as well as for control populations. And I think we also lack data on the intensity of exposure through a specific contact with the environment. And ideally, if possible, these could even include longitudinal repeated analysis over time to see how resistance really evolves. And very strong evidence could be gathered if these studies are conducted in situations where interventions are taken, for example, on sanitation or hygiene, and when then levels of resistance in the human population could be followed. And notably, many of the studies to date are based on E. coli only, with a focus on ESBL. So I think we also need studies that look at other pathogens as Nitrobacter, but also fungi, because we're still very limited with respect to the bacterial pathogens studied. And I think to finish off, it's interesting to see that there's actually quite a number of questions in the One Health priority research agenda that addresses particularly these exposures. For example, there's a question on the role of critical water, sanitation and hygiene infrastructure, and the role of human and animal waste is how they contribute to the development and circulation of AMR, and the relative impacts of different wastewater treatment solutions, and also what are actually the most important AMR transmission pathways in different settings. So I think the existing research agenda very elegantly summarizes research that is needed with respect to different environmental exposures. And I hope that triggers interest and further research in an optimal way. Thanks.
Yeah, thank you, Heike. I've tried to get some keywords, but I will wait for the other panelists before speaking on my side. Our second panelist is Phil Taylor. Phil holds a PhD on plant pathology from the John Innes Institute. He pursued the academic career and then switched to a very different way. He became a farmer and he grew, it's also interesting, organic, GM and conventional crops. So you have a very practical experience as well. But thereafter, you started to rechange again. You joined CABI and you became an important member of the Plant-Wise program. You could take charge of the training material and the training to overseas extension workers. So Phil, with your experience from a practical side and from an academic side, what is the current knowledge on the role of plants on the AMR transmission? And again, how you think can the agenda contribute to get better understanding here? Plants are the newcomers in this discussion, so we're very eager to hear. Over to you.
Indeed, thank you very much. Thank you very much for the invitation. And it says something about the times that we're moving into, the fact that here I am talking with colleagues from WOA, as well as FAO and WHO, so it's lovely involved. As you say, plants and crop production are the new arrivals. AMR has historically mostly been antibiotics considered in medicine, antibiotics considered in veterinary science. But now the world's changing. We're appreciating that there's a much more of a One Health system, and we're much more interconnected than we ever thought that we were. And my involvement in the AMR story has recently become about because of some data which we had relating to the use of antibiotics on crop plants in low and middle income countries. And until our paper, it was mostly assumed that antibiotics weren't particularly used on crop plants. And they were, the only documented cases were mostly in America against a bacterial disease called fire blight. But it's now clear that in South Asia and Southeast Asia, antibiotics are widely used on crop plants, particularly rice, and they're used prophylactically as well. So farmers who have insect problems or fungal problems will often be given suggested an antibiotic to add to their mix of.
We have a problem here.
This
looks like we lost Phil.
Yeah.
Antibiotics are entering the environment.
Sorry, Phil, we lost you for some moment.
Oh, sorry.
I don't know. Yeah, maybe you go a bit backwards. We are not late, so maybe you get a bit backwards on what you're telling.
I was just saying the fact that
we were just telling
antibiotics.
about rice and prophylactic use, and then maybe
right.
you can
Okay,
take it
so you
from
haven't
there
missed
because
much.
we were
Okay.
frozen off. Yeah, sorry.
Thank you. Yes, so our research showed that there was a great deal of prophylactic use of antibiotics on rice, particularly in South Asia and Southeast Asia. And that you then have to ask yourself, what is the environment? Sometimes we see the environment written on these diagrams. And in veterinary use and in medical use, antibiotics are released into the environment accidentally through sewage and through manure. But of course, when you're applying antibiotics to crops,
No, I don't know what's going to.
Yeah,
Yeah.
just wait for him. I think that is his connection.
Maybe we should write down. I don't know why we have problems. Because he doesn't seem to be aware. Maybe what we could do.
To move to the next.
Yeah. Phil,
wait for
can you unmute?
yeah, I'm sorry about that. I dropped out. I don't know quite why.
Okay, let's try once more. And if it
Yeah.
goes again, I will go to the next speaker and come back to you again to allow
Sure.
you. Yeah,
Yeah.
let's try once
Appreciate
more
that.
and
Yeah.
then let's
Yeah.
go that way.
Yeah. So I was just saying that the environment is a concept which is often used, but it's not clear what it actually means. And when people are putting antibiotics directly onto crops, they're often spraying the soil. And so the environment in that regard is very different from the environment in other spheres. So the application of antibiotics onto soil in many countries is widespread. And of course, whilst the amounts are relatively small compared to veterinary use and medical use, they still do add up. And our research showed that about 73 tons of streptomycin is applied to the rice crop in South Asia, or was applied. So the point about antibiotics on crops is that they're often mixed with copper, and copper is known to accelerate antibiotic resistance. And of course, herbicides as well can accelerate antibiotic resistance as well. So the blending and the use of the chemicals in this crop production manner is posing a particular threat. And of course, use of antibiotics on crops will give rise to, and has already given rise to, antibiotic resistant plant pathogens. But the danger is that that will then lead to antibiotic resistant pathogens, particularly on salad crops, which are eaten raw, particularly if you're using night water, which already contains low levels of human pathogens. So the concern is that plant pathogens will become resistant, they will share their genes with human pathogens, and we'll suddenly have resistant human pathogens. The extent to which this is taking place isn't really known, and people who defend the use of antibiotics on crop plants have said there is no evidence, and so therefore we should continue to use them. Other people are much more concerned about this and say that just because we don't know, it's likely to be occurring or will occur in the future. So that's a great deal of concern. The other reason that plants have been included into the One Health system is due to fungicide resistance. There's a relatively recent data that's come from Holland, Paul Verwee's work in Holland, who showed that antifungals used in the tulip bulb industry in Holland have been composted in agricultural scenarios, and the composting has taken place in a fungicide-rich environment because of the fungicides which were applied to the crop. So the composting process has inadvertently selected for fungicide-resistant fungi, some of which are human pathogens. So Aspergillus fumigatus is the one which is particularly of concern, because Aspergillus fumigatus has moved out of the compost heaps as a fungicide-resistant pathogen, and it's now infecting people's lungs. And so the therapies which have been used to treat these fungal infections in the past are now being compromised because of the resistance coming from the agricultural use. So the antibiotic use on crop plants and the antifungal use crossover is why our crops have been included in the One Health. With regard to how much we have to be concerned about the transmission, it's early days yet, and a lot more needs to be done to find out what a threat this is.
Thank you, Phil. I think they're very interesting new topics. I mean, I have several keywords. One what's very clear also, the interface that we make not expect. And it's also when you speak about rice, I'm a veterinarian. I know that a lot of byproducts from crops go to animals, so you will have another circle.
Yep.
Anyway, we will have time, hopefully, for further discussion. Let me now introduce our third panelist, Ungdip Chuanchen. She's a veterinary professor at the Faculty of Veterinary Science in Chulalongkorn University in Thailand. She's leading the FAO Reference Center for Antimicrobial Resistance, and her research focuses on molecular epidemiology and mechanism of antimicrobial resistance in bacteria, of veterinary public health importance using a One Health approach. So it's a bit a look from the veterinary side that we are lacking, I think, in the first two panelists, and we're coming together in an intersectoral discussion. To you, Ungdip, please. The first question. Let me ask you the first question, read it out because we have prepared. So what kind of research on One Health transmission is ongoing? What do you know about? And that will support the research agenda with focus on low and middle income countries. That is something that has been already told by Heike, that we have very few information in this part of the world, and most of the data come from the rich countries. So maybe you can give us a bit of view from your experience. Over to you.
Okay, so thank you very much for the questions. Okay, so actually, certain numbers of AMR transmission research has been already conducted in these countries, but not many of them are decided to connect among sectors, and this is mostly because of inadequate collaborations across the sectors, and most existing research primarily focus on AMR at each stage along the food chain. Okay, for example, AMR in food animals at farm or in slaughterhouses, meat in markets, or patients in hospitals. But most of them are usually at the particular point, locations, or sectors. And most research projects focus on AMR monitoring, okay, in different bacterial species at both phenotypic and genotypic level. And we can see now, okay, there are some introductions of whole genome sequencing to the countries, and more research and publications are from humans, okay? And for non-human research, the majority of research focuses on food animals, and also some kinds of like research on AMR risk assessment. Okay, it has introduced, and we can see, some country has started working on it. And I think if the connections, among the sector is appropriately created, okay, existing knowledge and also available research facility of local researchers who best understand the typical culture and also the situation of where they are working, could well support this agenda and also support the AMR One Health research. And I think the other one is how can we, get better integrated in terms of research projects in these regions, right? Okay, so I think the reasons behind the research projects in this country are rather complicated, and simply providing the research funding is not enough. And the key factors are interest, research impact, and also collaboration. Okay, in this country, I think that research collaborations, interactions, and also some kind of like cooperation between institutions really needs improvement. In my personal opinion, I think there is a need for a platform for sharing research, meeting different scientists in the same area, and also learning new research ideas and also advanced technologies. And such the platform could be at the local or regional level. I think I can give an example. Okay, this is the initiative of the first research conference on AMR and AMU in food animals in the Asia Pacific. Okay, it was conducted in February 2023, early this year. Okay, it was a stage, okay, for showcasing promising scientific research findings and also cutting-edge AMR and AMU technology in the region. And also its access approach to translate basic and advanced science into best possible policy formulation, and also provided a channel for researchers with the same interest in the region and also outside the region to start their communication. And besides, I also think that if research projects are integrated into policy making, okay, wherever it is possible and suitable, this will increase the significance or impact of the research, okay, and we can draw attention and get more integrations. And also, okay, research capacity building, either at individuals or institutions level, okay, is needed. This is to help cultivate the research culture in these countries. Okay, so I think this kind mechanism, okay, will help the researcher, yeah, to be, in this country to be more better in terms of research, especially for AMR transmission. Yeah, thank you.
Thank you, Rumtip. Again, another keywords about connection, capacity building. I think that's something that we also have in mind. We had a lot of discussion, as you know, in the research agenda, how we really approach the low and middle income countries so that they have their capacity strengthened. My next speaker is Amit Purana. Amit is a director of the Sustainable Food Systems Program at the Center for Science and Environment. It's a non-profit organization in New Delhi. He has been pushing for necessary changes towards food systems that are sustainable for all, farmers, people, and the environment. That's very much what we're looking for. He's worked on AMR, focusing on livestock, food, and environmental roots. So that's very much the topic of today. So Amit, one question that has started coming up is the differences between the low and middle income countries and the high income countries. So how do you see these differences regarding research on transmission? Can we transpose one to the other, or do we have to adapt? And we have some questions and guidance in the agenda as well. Please, over to you.
Okay, thank you very much, Elizabeth, and members of the quadripartite for giving the opportunity to share my perspective. I can say, Elizabeth, this is a very easy question, but at the same time, very tough question. So, I mean, just going back a bit, we really have to, one, understand that LMICs is one big basket. And within the LMICs, even if you go by the income, you have low income countries. And then you try and understand the sectoral focus. Let's say in a Southeast Asian country with a lot of aquaculture versus a country which is landlocked with a lot of dairy. So even within the LMICs, things vary. So at a very broad level, we can say, yes, there is a difference. But in my view, if you go deeper, we really do not know. There's no big answer here. There are exceptions. You may have a country like, let's say, with a very strong dairy sector, a very good research capability compared to a country in the high income country, which also has a good dairy sector. Mm-hmm. So yes, by and large, there would be differences, but there would be exceptions as well. Now, I also want to bring upon 2-3 fundamental points here. When we say One Health, the very idea of One Health, at least as much I see from my interaction in India and African and Asian colleagues, it's a new concept in the sense that we really do not know how it can be implemented on the ground. We know it's there on the paper. And we know that even within the AMR space, it was mostly about humans, but not much about animals and crops. And now we have animals and crops and environment. But it's largely the energy has been spent on human sector for the last so many years now. And when you see One Health and AMR, there's much more within the One Health beyond AMR. You have zoonosis, pandemic. So that level of dilution may also perhaps play a big role. The second point here is, the second keyword here is research. We are saying research agenda. Now, you take any sector in LMIC, then the amount of money that you see spent on research or allocated for research is much less than let's say money allocated for research in a high income country. for very obvious reasons. So research is something that comes very late in the perception of the even in the scientific community, if I may say so, or it's there, but it's not really as basic or fundamental. It's more about what brings more money, what brings more trade, what brings more productivity. So that kind of research perhaps will always gets prioritized. So within this framework, if I may say, I really see there are two broad components which will affect and which perhaps have already impacted the kind of research in HICs versus LMICs. And those two broad concepts are: one, the sectors, the nature of sectors, the scale of sectors. Is it dairy focus? Is it aquaculture focus? It is crops. Is it population centric, which in a way influences both the consumption of animal proteins, but also the human health sector? So that nature of the scale of the sector, then the nature of the sector, small farmers versus big farmers, industrial versus backyard. These things also will influence how things will play going forward. Then comes to the fact that how much a particular country produces for domestic consumption versus trade. Trade brings in dollars, trade brings in euros. That there is the return on investment on research, perhaps in a sector, in a particular country which has a lot of trade, will influence going forward how much they want to invest in research in that particular sector. Practices, for example, how much of the sector is industrial or intensive versus extensive versus backyard. Now coming to the waste part, I mean, how a country produces food is fine, but how it manages its waste, how much priority the environment, sanitation, hygiene in its first place in the social consciousness are there in a particular country. So these factors will play a role. But having said that, this is just one sector. We really do not know. There's this big One Health sector. Where are those people? Who are those people? And that's which basically brings me to the entire second component, which is the research ecosystem. What kind of machines, what kind of people, what kind of academicians, what kind of network, what kind of materials we have, what kind of existing technologies we have, what kind of existing results we already have or research we already have, which can be leveraged upon. What kind of quality control systems, data management systems, what kind of intellectual property rights. I mean, a lot of that stuff will come into picture if you really want to move ahead and try and do something which is similar to, let's say, a high-income country. So there's a long, long road ahead. What I'm trying to give you a sense is these, even if I say these are two broad areas, there are umpteen number of sub-areas which will ultimately influence the quality and the quantity of research that we would do. I also want to now, moving beyond this challenging and challenges and pessimistic approach, just want to give you an optimistic scenario. So clearly, what would work for us? Let's say, in my view, what would work will be collaboration. I already see a lot of that happening between the high-income country professionals and the scientific community of low-income countries, and that's where we have to invest upon. That's where we'll have to see what is useful. But important thing is, all those research collaborations have to be embedded into the local context. No point researching for something that is not useful for the local context. The second important possibility I see is prioritization. I mean, I will ultimately have a very small kitty for research. I really will have to see what really brings in more money, what really benefits the entire AMR scenario, not something which is just sitting in the lab, something which perhaps not really result in action or implementable, or is not really implementable, will not be something that a politician in our country would like to invest upon. So you have to be doing something which is locally relevant. You have to be doing something which is actionable, implementable, cost effective. But most importantly, it should be something which basically does not apportions the blame on a particular sector. It should not really leads to a situation where one sector starts saying, no, you are the problem, but I'm not the problem. So we really have to, the success would be prioritization. The success would be how you will utilize those very little dollars or money that you have in something which perhaps will bring in a lot of value in the long term, but not really very tangible benefits in the short term.
Okay, I think that touches many points of the agenda, because that also were mentioned. One is about also timelines. I mean, what you tell people want to see quick results. They should be basically make a big change, bring money and so on. That's probably not always possible. So we hope that when we had worked and you were with us in the research agenda, that will also give a bit of, we have tried, to make these groupings to see what is sort of needed before methodology. That might be acceptable for all different sectors. But I also got from what you told and also Rongtip told, there might not be one low and middle income countries basket. And I think that's, you have to go to the ground because that's the people where they understand. And how can we connect this? I think there's some very interesting ideas. Pilar has now our last panelist. Pilar has a lot of experience from her side, and we have already invited her to panel. Pilar is a senior researcher of Colombian Corporation of Agricultural Research, founder of the Colombian Program for Integrated Surveillance of Antimicrobial Resistance. And since 2018, she has led the Global Health Research Unit on Genomic Surveillance of AMR in Colombia. That was done with the support of UK. I don't give all the details. Pilar, we have a question to you because you have also practical experience in another part of the world when you're implementing projects on the circulation of AMR between sectors. And that's also something that Amit already touched upon. No blaming, how we can make these people work together. Pilar, over to you, please.
Thank you. Thank you, Elizabeth. Thank you for this invitation and good morning. We started working in 2007 with the support of WHO and PAHO when AMR was not a protagonist as it is today. I work for AgroSavia, that is an institution that belongs to the Ministry of Agriculture, but it's not a regulatory institution. So not being a regulatory institution allowed us to move between the human, animal, and food sectors and then the One Health approach. And we were not limited to working only in a single area. We launched a pilot of the Colombian Integrated Program of Antimicrobial Resistance Surveillance in 2014. The name was OHPRA, and we demonstrated that the circulation of selected bacteria between the different components. The objective of this pilot was twofold, and one was to establish the baseline data on antimicrobial resistance that was inexistent at that time, only for the human part, and to adapt working process between national institutes and future stakeholders of the COIPARs in AMR. To begin, we established an international advisory team and a public-private stakeholder consortium. And before starting, we validated the sampling scheme and methodology, established microbiological analysis, AMR, and fingerprint techniques. We work with PFG and also designed databases and protocols to capture information. We began working with one pathogenic bacteria, Salmonella, and two indicators, E. coli and Enterococcus, and their antimicrobial resistance to beta-lactams, cephalosporins, fluoroquinolones, among others. Then we add Campylobacter. In animals, we started with chickens and added other species such as pigs and cattle with the time. We work with the entire poultry chain from farms to the retail stores, and in some cases, we took human samples throughout the chain. For Salmonella and E. coli, we found a high prevalence of ampicillin, third-generation cephalosporin, and ciprofloxacin resistance. This was phenotypic. And also for Enterococcus, our results show high resistance to erythromycin and vancomycin, and quinopristine and dalfopristin. While for Campylobacter, it exhibited high levels of AMR against ciprofloxacin, erythromycin, and tetracyclines. At that time, that was 2010 and 2014, the integration was done with PFG, finding similar PFG patterns between humans, animals, and foods of animal origin isolates. Later, thanks to the UK National Institute of Health and Care Research and the Sanger Institute and the coordination of the Center for Genomic Pathogen Surveillance, we implemented WGS, or whole genome sequence. That is a cutting-edge technique that allows greater discrimination of bacteria. For example, the resolution of PFG E allowed the description of two major groups of Salmonella enteritidis, dietary isolates that were expanded using WGS to 8 clades. So the discrimination is a lot better. Last year, in 2022, we have implemented a new methodology, and it's to work with hotspots emergency of AMR. Hotspots answer local research questions about the circulation of AMR bacteria and genes. We work on an AMR hotspot in a region in southern Colombia called Betania Neiva, which produces 38% of all the tilapia that Colombia exports. Here, we took as a model group B streptococcus that affects humans with neonatal sepsis and meningitis in infants, cattle with mastitis, and tilapia with a high morbidity and mortality. We work with a systemic approach, and this is maybe something to answer the panelist that talked before. We work with systemic approach in a multidisciplinary group with medical doctors, veterinarians, microbiologists, bacteriologists, biologists, bioinformaticians, statisticians, and water engineers. And we established that there was no circulation of AMR between the different components. For next year, we will start our project that the name is One Health AMR Dynamics in Human Setting of Medellin. We call OHPRA, which aims to identify the main factors that foster the acquisition and dissemination of AMR of bacteria for recommendation about the design of effective interventions to curb AMR development in the city of Medellin, using the One Health concept and the complex adaptive system framework. For this, we form a consortium, so we always work in groups of experts of different areas. We form a consortium with the Medellin Resistance Group, that the name is Hermen, and that has 42 hospitals in humans, a public university, that is the University of Antioquia, that work with the animal sectors, and this time we are going to include pets, one private university, and a center for genomic research and services, besides all the support of the Center of Genomic Pathogen Surveillance and the Oxford University. We will work with 7 bacteria, and we will use WGS and also metagenomic sequencing. It is an ambitious project. We need more funds. Even we had some funds, or we have funds to begin. And so at this moment, we are in a campaign to obtain the missing financing. And this could be all in this question.
Now, hopefully we will have keep the connections to see how it's going, because I think you have started quite early, come up with your experience, and now you really design something which basically should give an answer, very precise answer. What are the factors? That's quite interesting on a country level. Probably everybody's looking forward. We have time for a second quick question to each of you. That's a bit related with what we heard already. We've been listening on, the research agenda is a global agenda, and we recognize that it needs to be adapted. And we have heard already some comments on how. So Heike, you have also experience in low and middle income countries. So do you consider that these research questions need to specifically be adapted to each continent, or how should we go with this? Heike, over to you, please.
Yes, thanks. Indeed,
please,
I think
sorry, Heike, maybe only 2 minutes so that we're not getting too late. So it's sorry for this.
Yeah, I try. These research questions indeed have to be adapted to the country in question, and as has been argued by Amit as well, to the region and the particular subpart of the country, importantly as well. And differences between research that has, for example, been conducted and that might be needed is that drinking water quality has not been investigated in Europe and in northern countries so far, but the drinking water might play a totally different role in transmission of resistance in other parts of the world. So we might study indeed totally different transmission routes when we speak about other countries. And that also holds true for other transmission routes that might be understudied, because there might be fundamentally different ways of how water is used for what kind of purposes in specific populations, for example, for household purposes or for cleaning. So I think we have to broaden our view and think carefully about what relevant transmission routes could be and how we could study them in the most effective manner. And these will differ from research that has already been conducted in high-income countries. I think that was my short intervention.
I haven't looked because I'm listening, but you looked very quick. Anyway, I think that interesting questions, because might be also interesting to see if you have experiences from one part of the world that might fit another part of the world in a different way, not one basket is it all, not low and middle income countries, but maybe others. We have other questions on this. I'm going to the question of plants that are sort of were a bit neglected in the past. So Phil, how do you think that the research agenda could help to increase the interest in these questions in AMR research in plants? Over to you.
Well, thank you. Yes. I have to say that crops and plants have been very welcomed by, first of all, UNEP and the quadripartite in general. So me personally, I've received a very warm welcome from all of my colleagues working in different fields. And how it can be extended, everybody wants to be comprehensive in their concept of AMR, and now crops are being included, which is great. The one aspect which is a tricky one to incorporate in AMR and the One Health is the use of fungicides on crop plants. I spoke previously about fungicide resistance spreading from plant pathogens or composting fungi into human pathogens, but it's plant pathogens resistance to fungicides, which of course is important as well, and that is such a big topic. It's difficult for the One Health AMR community to embrace that as well. So I'm not sure how we can include that, because it would require a huge rethinking of the whole of the dynamics of the One Health AMR, removing it from an antibiotic-centered, human health-centered approach to a crop fungicide-centered approach. So I'm not suggesting that we should necessarily completely turn the whole thing around, but it's a difficult one and it should be considered, particularly now that we have, or Paul Verfey has found that there is fungicide resistance crossing over from fungi, environmental fungi into human pathogens, because of course that may be occurring with other classes of fungicide as well. So how can the AMR community increase their awareness of plants? Well, I think they're doing a great job at the moment. So please, thank you very much for the warm introduction to the AMR community.
I'm here for a long time, as you all know. So I was interested in these questions very long time, but nobody wanted to take it up in early stages. And then we also have, so we have included in the research agenda, just to remind, fungicides, but also antiparasitics, because that's a real issue also from the animal side. And we have one, ivermectin has become very popular in the COVID period, where every veterinarian in the world was very surprised. But anyway, that's another question. But we'll not forget it. Maybe we learn by antibiotics and then can get over to others. But thank you very much for mentioning this, because it's true we don't have so much experience yet. So my next question will be a quick one, because partly you've already been taking this on account to room tip. How can we do that really we get better integration of low and middle income countries in research projects? You have spoken about capacity building and told it's not only money. So maybe you can a bit give another view on this, please, room tip.
Yeah, so I can just give the summary of my, answers before, right? So I think, like I just mentioned, right, money may not the only thing that can help, okay, in these countries. So I think I would like to highlight on the capacity building. Okay, this is not just only between institutions. It has to be an individual researcher too, because we would like to keep this one for long, and also we have to strengthen the local ownership, of the research. And also it's very important that we open the platform, for the research in this country, for them to know each other and also to share the research findings. And also it's a chance for them to learn new technologies. And also I think it's very important that, in this country, we have to increase the impact of the research. Okay, and the simple way is just to link this one, okay, to the policy makings. Okay, we should link the research scientists to the policy makers. So in this case, we can call for the collaborations, and also integration of the research project. Okay, so I think, yeah, I just want to highlight that sometimes, they need money to start the project, but in the same time, they also need some other support to be able to carry on their research, and also it will last long, in the future. Yeah, that's it. Thank you.
Thank you very much. I think these words on platform sharing, collaboration, that's something that we hopefully in the future with the agenda could help doing on a global level for sure, but that might be a way, hopefully, that we can help for this. So now, Amit, I will slightly change the question to you because you've answered part of it. Because the question was, do you think that research priorities identified need to be adapted? I think you already told, but maybe you can try to tell how you think that can be done. Because you've told there's a huge bucket and you have to, so maybe you have some ideas how this can be done.
Yeah, okay. So, I mean, for example, there's in a country which doesn't really have a lot of harmonization and quality control of laboratory or research systems, perhaps a lot of work would, at its first place, needs to be done in the methodology development part of the priorities, right? A sector like dairy in India, which has a very big project on ethno-veterinary medicines, it clearly tells us how alternative traditional herbal preparations are helping reduce antibiotic use. And if we can now monitor the impact of that in terms of transfer of resistance, is something that would be useful to this sector in a particular geography like India. Now, and as I said earlier, I mean, the question of a lot of urban versus rural thing is useful in countries where you have, I mean, for example, in India, I can tell at least for sure that most of the manufacturing as well as most of the animal food production is not really centered around the urban landscape. So clearly, you have an urban and rural area kind of research geographies where you can align your research around. But if you want to focus on urban, perhaps you may have to focus more on that will give you more insights on the human health, human roots, human pathways. But what is very important is in a big country like India, for example, we have several states, and each state, I mean, each state has its own budget. It's like a federal structure. So states move very fast from than the center. And they also know the local context. And some of the states are good in pharmaceutical sector. Some of the states have hubs for poultry. Some of the states have hubs for aquaculture, the coastal states in particular. I mean, that is where a lot of prioritization, a lot of customization, and a lot of context that would be useful, because ultimately they will have only a limited amount of money, and they'll have to use it to the best of their understanding that helps them get to know something which is really actionable. So that's how I see it.
Yeah, I think there's some interesting ideas. So we'll discuss this afterwards, maybe with you as well, because I think how we can make this sharing, and maybe we can, instead of like with low and middle income countries or low and rich, going to pictures that might be similar in different parts of the world. That's something we need to keep in mind. So Pilar, for you, I have a last question. You have an experience in establishing partnerships with research institutions in high-income countries. So what are your suggestions for researchers in low and middle-income countries when they want to implement? How was your experience in this? How can we connect these two worlds? Pilar, to you, 2 minutes.
Thank you. Okay, yeah. So the first thing is to join or to work very close to the quadripartite organization as a starting point, since it would act as a scientific committee, or you would act, and try to obtain, also help to obtain seed capital. As I said before, I work with WHO and PAHO, and now with the Global Health Research Unit on Genomic Pathogen Surveillance. Then we have been working for 2 years in the agenda of antimicrobial resistance. And we have the support of the Ministry of Agriculture, but we decided to work on a bottom-up approach instead of a top-down, because we considered that could have more success in our country. The first thing that we did was map the AMR research groups in Colombia and have virtual or in-person interviews with each of them. We identify a specific condition of Colombia through working workshops, but also in the workshops that we did, we found like 82 ideas. It was very difficult to work. So looking at this or seeing this, we propose to working in a systemic approach. We avoid, we recommend to avoid the reductionist approaches. And our first example was the hotspot that we showed before as a systemic approach. Also, your guide, the AMR OHPRA guide, we need to adapt the priorities to the conditions of Colombia, and this is going to be our first step, the following step that we are going to do. We continue working with these 19 research groups and 30 members in a hub and spoke organization. So we are the coordinators, but we have all the same. We relate in a horizontal way, and following the bottom-up approach, now we are conversing with the Ministry of Health and its institutions, the Colombian USDA and FDA, and the environmental ministry, and that's all.
Sounds you were quite successful. Maybe that's the magic point. Or you started early on. I don't know if we have a question from the audience, Jorge, because I can't see a lot.
Yeah, we have 2 questions so far, but we invite all the participants to share your questions in the Q&A box, so they will be answered after this panel discussion. I will bring all the panelists to move to the Q&A. So we have the first question, and thank you first. Thank you, Elizabeth, and experts for this fruitful panel discussion and for sharing your views and experience. So for this Q&A session, we have the first question. I think that is for Pilar. It's about what you mentioned about your projects. How did you discover the hotspots? Do you have a surveillance system for human, animals, and environment?
Pilar, you are mute, please.
So we established the workshops doing characterization of different areas. In Bogota, for example, that is the capital city, we have some that includes markets in the same place, also hospitals, big, like we call 4-level hospitals, and rivers for the environmental, and we describe them, studying and characterize the different levels. In the country, we are at this time working with the human. We did a pilot study of antimicrobial resistance surveillance, a pilot project that I mentioned that was in 2014, but now we are working in an intersectoral board with all the official institutions, and we have the first could say sampling and integration of bacteria for the surveillance program in the country now with the official institutions. I don't know if I answer, or maybe you tell me if you need more information.
Thank you very much, Pilar. The second question that Heike already provides some answer, but I think that it's better to also share here. Maybe this question is for Heike, and also I will ask Philip. It is from Sabiha Esak. Transmission is inferred from the presence of similar drug-resistant bacteria, antimicrobial-resistant genes, and associated mobile genetic elements at the interfaces. What research is needed to show directionality such that intervention can be instituted at the source? Heike?
Yes, Abia, that is obviously a difficult question, because that requires studies that are very well designed and often can be quite large, because I think what we clearly have to distinguish is different types of possible research setups that could be used. And one of those might be epidemiological setups that have been frequently used, for example, in the Netherlands to underpin animal to human transmission. And these would consist of carefully selecting specific human populations that are either exposed or non-exposed to a particular interface. So, for example, to animal to human contact, or to surface water to human contact, and then study the prevalence of resistance in any form of resistant bacteria or resistance genes or mobile genetic elements in those populations. And the tricky part in there is that we carefully have to contextualize this and think about other risk factors for carriage of resistance that might influence any prevalence of resistance we might see in these populations. And other aspects, a fundamentally different approach could consist of modeling, exposure modeling, so in the sense of risk assessment, but then limited to exposure assessment. And that is a much more theoretical approach, where we would use concentrations of resistance in a particular interface, in a food commodity or in water, and then we would think about how intensively people are exposed and what the resulting exposure level or the dose would be that we assume humans to take up. And these often are based on much more scarce information and many more assumptions. And these are also more difficult to translate into actual human health outcomes, such as infection or carriage still. So both of these, I think, are not easy. Both of these don't provide the full picture, but I think if some of these studies are combined, we would get a joint vision. And maybe the last one that is currently happening in some countries is these natural interventions. For example, in the Netherlands, we have seen a huge decline in the usage of antimicrobial agents in animal farming. And the question then can be studied in how far does that affect human carriage of resistant bacteria. And similar interventions might take place in other countries that could be used to study the outcome on resistance in terms of human carriage. I hope that answers your questions.
Maybe we can, I think, Rungtip and both Pilar. Rungtip, do you want to add something? I think you have your hand raised.
Yes.
Yeah. Oh, sorry.
Okay.
Go ahead. Sorry.
Rungtip, please, and come back to you, Pilar, because you was at already the floor.
Okay, so thank you. So I just want to add, as just like I'm a veterinarian working on veterinary public health. So I would like to add like what the research that we really need in this case is for it's called farm to fork research. So we can just start to study the AMR from farm, animal at farm or at slaughterhouse, and then go to the meat, and then go to people. Okay, for these people, it could be patients, workers, or even the butchers. Okay, and what the research or the experiments that we need, it could be both phenotypic and genotypic level. For the genotypic level, it could be prevalence or AMR patterns. So you will see, okay, like what exactly the problem. And also for the genotypic level, okay, we can do just like a target gene detection. So it could be the genes that could be found or linked between human and animals. And also we can do bigger pictures like a whole genome sequencing, okay? But anyway, we still need the complement data, in the phenotypic data. And also, I would like to add some kind like we call transferability testing. Okay, this one, it could be the in vitro proof, okay, that there really is the horizontal transfer between the genes. And right now, when we talk about transmissions of the AMR, right, we cannot avoid this one, the R plasmid. So it may be good if we can do R plasmid characterization, for example, incompatibility group. So in this case, we can tell the relationship or the relatedness, okay, between the plasmids. And in this case, we can see the evolution. So if the plasmids from different sectors are from the same evolution or not, so this implies, okay, the transmission route, okay, of this system. Yeah, thank you. That's it.
Thank you. Pilar wanted to contribute.
What we wanted to add is about that we are looking, because we don't have a lot of data. We have whole genome sequencing in place. So now what we are going to do is to do this approach in systemic, and also introducing the theory of complexity to see if with less data, we can get to establish interventions that could curb the antimicrobial resistance, because there are lots of information about antimicrobial resistance in the world, but the resistance continue to grow. So we hope that we can do some addition to this research in the world.
Thank you very much, Pilar. Phil, that's you have raised the hand? Or,
just going to say that from a plant point of view, the use of antibiotics on crop plants, it's the people who say that there's been no transmission between no increase in AMR because of the use of antibiotics on crops. They can't say that with authority, because no one's tracked the genes from one system to another. So it's very difficult. It's a very good question. Of course, we are getting plant pathogens which are resistant to antibiotics because of continual use. And that's why people are moving to other antibiotics, because of the resistance in the plant pathogen population. But to then make the jump, just make the claim that it's leading to pathogens in other examples is a very difficult one. So it's a very good question. As an aside, I was talking to Paul Verfe regarding the fungal resistance from compost heaps spreading to human pathogens. He found it very, very difficult to get any money. He certainly suspected that there was this link between compost heaps and resistance in humans, but he said he found it very difficult to get any kind of funding, simply because people didn't believe that it could be taking place. But of course it did, and he was proved correct.
Yeah, I think that's, again, I think that's when you're new, but we should interest the young scientific community. They have an open area, yeah. So hopefully we'll get help there. I think it's time to close the panel session. I really would like to thank all my panelists because we had a quite interesting discussion. It's a pity that we couldn't be face to face. I think it would have been ongoing with whatever lunch or dinner. So I can only say thank you. We'll come back and hope that's the first one on the focused pillar. We'll have other ones and then come back with our keywords. One of them was sharing how can we share what's going on here and there. I think that's something that agenda can really help for, hopefully. And I will hand over, I think we have to Jorge, because we're towards near the end of the session. So again, many thanks to all, and for sure also to the participants. But as we don't see them, it's always a bit more neutral. Thank you very much, and over to Jorge.
Thank you very much, Elizabeth, and thank you, panelists, for sharing all this. I think that now all the participants knows that we have a lot of work to do, and we have a lot of opportunities on research. We will know more about the findings on this transmission pillar of this research agenda. this pillar is really important and needs to be addressed to get more evidence that can provide more accurate information, and also to understand the magnitude, and also to understand more about AMR in the interface. And this is to develop and establish strategic actions and interventions to contain AMR. We encourage you, all of you, to proactively support the implementation of the agenda, especially for donors, the research communities and countries. Some of the panelists mentioned the challenges that we have in low and middle income countries, but also we can look for collaboration with the research community to join efforts and collaborate to get answers on these gaps that the research agenda identify. So thank you. And with that, we have reached the end of this webinar. Thank you, everyone, to join. And we will send the invitation for the next one in January. So happy holidays, and thank you for joining.
Thank you very much.
Thank you very much. Bye-bye.
Bye.
Bye.